Take our lead, let's help you make your mark. Our goal is your satisfaction. Let us show you the way.
This may lead to irritation of the airways and lungs, contributing to cough or possibly even an infection like bronchitis, pneumonia, or inflammation of the lungs called pneumonitis. The air pressure may blow these organisms directly into your lungs.
Take our lead.
Every 6 months, check the filter at the back of your sleep apnea machine. A buildup of dust can impede the effectiveness of your treatment. If you live in a dusty area, or close to the sea, you will need to replace the filter more frequently.
Make your mark, take our lead.
The CPAP device often prevents the need for a breathing tube because oxygen can be given through the breathing mask to push the fluid out of the lungs and back into the bloodstream where it belongs. The relief is almost immediate, says James McCarthy, medical director at Memorial Hermann S. Emergency Center.
Make your mark, take our lead.
CPAP therapy works as you breathe through your nose, and having an unstoppable runny nose is a sign that it's time to clean the device. If you experience other symptoms such as a sore throat, lung irritation, respiratory infection, or congestion, these could be signs that your system is dirty.
Make your mark, take our lead.
Ideally, CPAP compliance should take place for as long as the patient is sleeping, but, in practice, this occurs in a minority of subjects. Based on several studies, compliance of as greater than or equal to 4H per night has been considered acceptable.
Let's help you make your mark.
Machines are not necessary to clean your CPAP. Most CPAPs can be cleaned with mild soap and water as described in the owner's manual for your machine. Some manufacturers recommend using diluted vinegar.
Thank you for watching. Please subscribe and hit the bell notification.